Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. This first company is with Point 32 Health. The job is a clinical reviewer, inpatient RN. This is full-time and you must be a Massachusetts nurse. I always go straight to the qualifications, and just in case you don't meet all qualifications, I still suggest that you apply. This job requires you to have, of course, an RN license in the state of Massachusetts, a associate's degree, but a BSN is preferred. They require 3 years of clinical nursing experience that's considering the bedside, and 3 years of utilization management experience. Now, they do mention here the skill requirements. If you want to get evidence-based criteria, experience, or actually certifications, you can go to Interqual or MCG certification. Just do a search on Google and it will take you to two places you can go to get certification for Interqual or MCG. Now, this Point 32 Health does not mention either or, but that's an option. They say right here, they have P32H medical necessity guidelines. I've never heard of that. That must be something that's only internal to their company. Also, this bullet point right here where it says proficiency with or ability to learn technology-based programs, such as Microsoft Word and Excel or other programs as needed. On your resume, add platforms. That includes Microsoft Word, Epic, Cerner, Protouch, Meditech, whatever platforms or software you currently work on at your current job and previous jobs, add that to your resume to make your resume more tech savvy. And I'm going to scroll down towards the bottom. The salary range is $94,136 to $141,204. The next job is with Enable Comp, and this job is a nurse review auditor for Franklin, Tennessee, United States, remote. I'm going to go straight to the qualifications for this job. They want you to have an active RN license, ADN or BSN required, but a compact state license is preferred. So if you don't live in a compact state, this is a good job for you. They want you to have 2 years of medical necessity reviews, admission or length of stay, et cetera, et cetera. I'm going to go past that. And 3 to 5 years acute care hospital experience in one of the following, one or more: ICU or trauma, surgery, orthopedics, neurosurgery. Here are some prerequisites. Make sure you do add the platforms to your resume. And we're going to skip through some of these bullet points. And this job does not include a salary. On to the next position. This is with Care First, Blue Cross Blue Shield. This is a care manager RN. It is full-time. This position requirements include RN license, state license, and or compact state license, nurse in Maryland, Virginia, or Washington, D.C. upon hire is required. They want you to have a CCM or other RN board certification, certified certification in case management. Incumbents not certified at the time of hire must have 2 years of case management experience and meet requirements to take CCM exam and successfully achieve the certification within the first year of employment. Upon hire preferred. So if you have experience, this is a good job for you. 5 years clinically related experience working in care management, discharge coordination, home health, utilization review, disease management, or other direct patient care experience. Preferences are bachelor's degree in nursing, a CCM or ACM or other RN board certification, certified certification in case management. We're going to pass this up. And the salary range for this job is $72,216 to $143,429. This next job is with US Oncology Network. This is a virtual triage RN senior remote, and the location is showing as Dallas, Texas. Straight to the qualifications. And the qualifications for this job include graduate from an accredited program for professional nursing education, BSN preferred. They want you to have at least 3 years oncology experience. That's needed. Willing to consider a mid or senior level experience candidate. Oncology or applicable specialty experience required. Current RN license with the applicable state board of nursing and current CPR certification required. Just FYI, I don't know exactly why they require you to have a CPR certification if you're working remotely. The 3 companies I've worked for are all major insurance companies, and neither one of it required me to have a CPR certification. And this job does not include the salary. Next position is with Blue Cross Blue Shield of Minnesota. This position is RN Case Manager. And the qualifications are RN with current Minnesota license and with no restrictions, our behavioral health professional. It's also who else can apply. That is clinician license for independent practice with one or more of the following licenses with no restrictions. 3 years of relevant direct clinical care experience. All relevant experience, including work, education, transferable skills, and military experience will be considered. Very nice. CCM certification or ability to obtain within 3 years of starting the position. We're going to skip some of these. Flexibility to work varied hours. Don't say exactly which hours. And preferred skills include 1+ years of managed care experience, case management or health coach, utilization management and or auditing experience, and the pay range is $68,900 to $91,300 to $113,700 annually. So this is a very strange pay range, but this is what it is, and it is remote. The next position is also with Blue Cross Blue Shield of Minnesota, and this one is an RN specialist, complex case manager for pediatrics and ICU. And the qualifications for this job is 3 years of clinical care experience, including pediatrics or NICU, 1 year of managed care experience, case management health coach, utilization management and or auditing experience. And let's skip some of these. We're going to go down to required skills and experience. So RN with a current Minnesota license, no restrictions. And like the previous job, all relevant experience, including work, education, transferable skills, and military experience will be considered. 5 years of relevant clinical care experience, CCM certificate or ability to obtain within 3 years of starting the position. And we're going to skip down some of these. So this one also includes a flexibility to work varied hours. Compensation is very strange. The pay range is $79,100 to $104,800 to $130,500. The next job, this one is with CareSource. This is a clinical care reviewer 2 RN multi-state licensed. And this job requires you to have associates of science in nursing, RN required, 3 years of clinical experience. That's considered a bedside, med-surg, emergency acute clinical care, or home health experience preferred. These are all preferences. So if you have this experience, this is a preference, this is not a requirement. I'm going to go down to where it says licensure and certification, of course, an RN. And they want you to have MCG certification or must be obtained within 6 months of hire required. And you can go to the description box below. It will take you to a website called Cure Bedside Burnout. You'll see a navigation link at the very top of the screen. Click on that navigation link that says resume tips. And then once you get to the resume tips, a new screen, it will show you at the very bottom of that page where you can go to get MCG certification. And the salary compensation for this job is $62,700 to $100,400. This is hourly. The next position with CareSource is also, this is actually a medical director. This is for doctors, remote appeals medical director, Pacific Standard Time, managed care. It's a very long job title. And there are many doctors who work remotely for different insurance companies as well as hospitals to review clinicals just like nurses do. Now, this position requirements are completion of accredited medical degree program as an MD or doctor of osteopathic medicine is required, successful completion of residency training program, preferably in primary care, 5 years of clinical experience, managed care, medical review, or medical director experience preferred. And managed care is just basically working as for an insurance company, or sometimes you can also work for a hospital in managed care. And then once you have a bachelor's or master's degree in business, operational excellence, healthcare administration, or medical management preferred. For the competencies that is required, and licensing includes unrestricted license, practice medicine in state of practice, board certification, recertification is required by specialty board, must be maintained, and MCG certification is required or must be obtained within 6 months of hire. And this job compensation is $195,200 to $341,600 compensation. And this company is called Concerto Care. This is a clinical excellence RN. This job requires current RN license in good standing, bachelor's degree or equivalent years of related work experience, master's is preferred, 4 or more years of clinical experience that's considering the bedside. 2 years of quality, patient safety, clinical audit, and or clinical policy experience, CPHQ or CPPS certifications highly preferred, ambulatory provider-based experience highly preferred. I'm going to pass all that. And let's see what else they have here. So the salary is $85,000 to $95,000 per year. I do want to add one more thing. Just make sure you focus on these 3 important things regarding your resume. Focus on what you did, why it's important, and how it relates to your job that you want. And also make sure that you look at the description box below. I have lots of tips on how to create your resume, as well as the template of your resume, as well as over 90 companies that hires nurses remotely. So just don't forget to look at the description box below to get more information, and see you again next time.